Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 223 of the Ask Dr. Angela podcast. It is absolutely gorgeous here in the Jersey Shore. I was so tired of the rain. I mean, it was so gray. It was raining all the time. I was like, is this June or what? Anyway, I think the weather has finally made a turn, if you will, and the next week is going to be absolutely beautiful. Sunny skies and warm weather. Welcome. Anyway, since we last convened, I have turned a year older. 45, baby. 45 and still going and going and going. That's like the Energizer Bunny, right? That's kind of how I feel sometimes with the way that my schedule is. It's just absolutely crazy. So interestingly enough, I do happen to be on call, and we've got a patient that we're inducing for IUGR, intrauterine growth restriction. And the reason that I bring this up is there are many different reasons that we induce people prior to 39 weeks. The American College of OBGYN does not recommend elective inductions prior to 39 weeks, but sometimes there are medical or obstetric indications that dictate that we induce you prior to 39 weeks. So this particular young lady, I walked into her room this morning and she's like, oh my gosh, I've been here forever. And I looked at her and I said, love, induction of labor is a process. And I think that's one thing that we have to do better at as OBGYNs of informing our patients, that induction is a process. Labor is a process. The reason that I'm emphasizing this is that this particular patient has already been in the hospital for 2 days. So today I think is finally going to be the day that we meet baby. But I mean, when we're inducing patients, if your cervix is not favorable, and there are tons of things that go into determining whether or not a cervix is favorable. I mean, position, is it posterior, mid-position, or anterior? The consistency of the cervix, is it still firm or is it softening up? Dilation, is the cervix closed or has it started dilating? Effacement, or how thinned out the cervix is. That's that number that you hear us talking about with regards to percentages. You'll hear us say 50%, 70%, 80%. We're talking about effacement, or how thinned out the cervix is. And then last but not least is station. How high up is the baby in your pelvis, or is the baby even engaged in your pelvis? So I was really happy to see that finally, after many different maneuvers and tricks, us OBGYNs, we have a ton of tricks up our sleeve to try to get you more favorable for an induction. I think we're finally going to do it today. Regarding those tricks of becoming more favorable, they can include anything like the prostaglandins, whether that's Cervidil or Cytotec, and those are medications that we place into your vagina, and they sit posterior or behind your cervix. Sometimes we use Cook catheters or Foley balloons to help mechanically stretch your cervix. And then last but not least, there's good old Pitocin, which is that medication through your IV that we use to induce uterine contraction. So the moral of the story is, and I mean, I just ran over a ton of stuff in a very short period of time, is if you're being induced, whether it's elective or whether it's for an obstetric or medical indication, be patient, because these things certainly can take time. And, again, there's a ton of medical reasons or obstetric reasons for which we induce people prior to 39 weeks, but that's a whole nother podcast, which we'll get to on another occasion. So hopefully, I'm hoping that someone has gotten something out of this podcast, because it's always a pleasure. As is usual, I'd like to thank you so much for tuning in to the podcast. You guys continue to completely blow me away and amaze me. We're getting stuff sent to our headquarters to try new things, and we're getting tons of questions via social media, direct email. Love the questions. Please keep them coming. We will get to them. I promise. If you happen to have a question or a topic that you want featured on the podcast, you know how to reach me, www.askdrangela.com. That's AskDrangela. That is where it's all going down. You can sign up for our amazing blog. You can sign up for any of our social media venues or direct message me with questions on social media. We're on Facebook, Instagram, Twitter, or you can directly email me. However you want to do it, we'll get back to you. You can also subscribe to our YouTube station where we're shooting all kinds of informative yet hilarious videos. So check us out. In closing, I'd like to leave you with this. The grass isn't always greener on the other side, unless you're my neighbor that lives behind my house and you're looking into my yard, because my grass is actually greener. No, literally. Our landscape was amazing. And I'm like so thrilled with what our yard is looking like these days. So until next time, look better, feel better, be better. Cannot wait to reconnect on episode 224. See ya.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.